a large number of patients we see have atrial fibrillation. It is a very prevalent condition, and it is, an arrhythmia in your heart. The top part of your heart and the bottom part of your heart don't really communicate. Patients come in with palpitations, dizziness, lightheadedness, shortness of breath, unexplained, and then on an EKG we see that. And if their rate is high, the two areas that we use to treat that is, one, to control their rate, put them on a rate controlling drug, and also to, obviously, in atrial fibrillation, you have the ability to, or higher incidence of having a stroke. So we put them on a blood thinner. That can be Coumadin, or it can be some of the newer medications that we have, that you don't have to get your blood drawn every week, and it's not that your dietary, there's no dietary restrictions, and there's no food interactions with the other medications. We do tell patients about alcohol. With Coumadin specifically, we certainly, with the Mediterranean diet, we included in that is that you can have 1 glass of red wine. I think the guidelines are that men can have 2 and women can have 1 glass of alcohol a night, and then, knowing that it's a regular glass, 6-ounce glass, it's not, or 5-ounce glass, it's not a big glass. But we tell patients they cannot take their medications with alcohol. Certainly the fear for our older population is alcohol and getting a little unsteady, and if they're on a blood thinner and they fall and they hit their head, that can really set them up for some kind of hemorrhage. So it's really important when I talk to patients about alcohol, and if they're elderly patients that are already unstable, I really do try to talk to them a lot about, if they're going to drink any alcohol, a little bit, it has to be a little bit, not very often. I'd prefer them not to drink alone, and just know that could affect their balance and cause them to have a fall.